Today we are going to discuss another important topic that is the NT scan in pregnancy. We know that NT is nuchal translucency. We do this test especially in the first trimester with the dating scan. So timing is it has to be 11 to 13 weeks and 6 days because this is the time where we can detect the NT properly. So the crown lump length has to be 45 to 84 millimeters in length. That is the fetus length from crown to rump. It has to be 45 to 84 millimeters. And the accurate gestation age assessment has to be, it is very much required. So usually this NT scan done during the dating scan. So the normal measurement has to be 3 millimeters. So if it is less than 3 millimeter, the NT, that is normal. If the NT is more than 3 millimeters, that is abnormal. So we should know what are the associated conditions with abnormal NT, that is the increased NT. So with cystic hygroma, Turner syndrome, and trisomy 13, 18, Down syndrome, and structural cardiac defects and the twin transfusion syndrome, we get these increased NT. So out of these, Turner syndrome, trisomy 21, trisomy 18 and 13, all these cases we have to do the karyotype to come for a proper diagnosis. And for the structural cardiac defects and twin transfusion syndrome, we have to do the fetal echocardiography. NT is not a diagnostic test. It is we do NT, and if we detect any abnormality, then we have to go for the diagnostic test. And coronary sampling and chorosynthesis, amniocentesis, and all these things are the diagnostic tests. And the prerequisites for NT scan, we have to have the correct accurate gestational age, and it has to be 11 to 13 weeks and 6 days. And the CRL has to be 45 to 84 millimeter, and the single normal developing fetus has to be there. So after when the fetus is more than this 13 plus 6 days uh, maturity, is the usual the fetus become flex and it will move. So it is difficult to measure after 13 weeks plus 6 days the NT. So now we are going to discuss the detection rates. So with NT alone, the detection rate of anomalies is 70 to 80%. With NT plus Papa A and Beta SCG, the detection rate is usually 85 to 90%. And with NT and NIPT testing, the detection rate is 99%. Thank you very much.